This is Dr. Andrew Jones. In this edition of Veterinary Secrets, I'm going to be discussing excessive salivation in cats, what it is, what causes it, and some of my most effective home remedies. This is Rockstar. He's called Rockstar. I'm not sure if he is a rockstar. He definitely is a rockstar to his family. He has never been in video before, and I'm sort of finding that these guys who get to be in front of the camera aren't always so cool about me poking and prodding. So let's just see what he lets us do. But he's going to be a great example for today's video. So we'll let him wander away and I'll bring him back when I need to. So today's video is about excessive salivation. The veterinary term is called ptyalism. And what that means is actually hypersalivation, where you're seeing these guys excessively drooling. Sometimes you'll see sort of long sort of lines of saliva coming out of their mouth. It's very uncommon at all to ever see a cat who is excessively salivating. So as I was saying, there's about 4 or 5 things, really common things that can cause this excessive salivation. And there's a few fairly simple home remedies you could be considering if your cat has one of these conditions. So first thing I want to do is just show you how you would properly examine your cat's mouth if they were excessively salivating. For the majority of times it's something happening orally within their mouth. So you need to have a good examination generally of your cat overall. Have they been sneezing? Have they been coughing in any way? Have they been acting nauseous? Have they been, have they potentially have eaten something they shouldn't have? Have they thrown up? But I want you especially to focus on having a good examination of their mouth. So what that means is, as a cat like Rockstar, okay, let's just show them. Well, he's actually showing us because he's going to open his mouth. Oh, nice kitty. So it looks like my attempt to examine Rockstar's mouth is not going to go that well, so I'm not going to show you guys. But the biggest thing, what I want you to do is just be able to open your cat's mouth, assuming he or she will let you. Have a good, just lifting up their lips, just being gentle at first, so you're not hurting themselves. Just sort of run your finger around their lips, looking around their lips, you're seeing any ulcers in any way. Then if they open up their mouth and you can see their tongue, having a better look at their tongue. Does it look like there's any erosions or ulcers or type of inflammation on the tongue? It should sort of be an even sort of rough pinkish color. And then I want you to have a really good look at their teeth, especially where their teeth are joining the gum line. If you're seeing inflammation in that area, and especially if you're seeing a thing called a furrow, which is actually an erosion right through the enamel of the tooth, often right at the gum line. Those can be quite painful. So generally you need to have a good look at the lips, a good look at the gums, a good look right where the teeth join the gums, and a really good look at the tongue. So let's look at the most common reasons along with some of the things that you could be doing about this at home. The most common reason I would see cats coming into veterinary practice, more often they're sort of younger cats, a year and younger, and clients would say, my cat's excessively salivating, he's drooling, and it doesn't seem to be stopping, which is definitely that requires a veterinary exam. Where someone do a good thorough examination. Most of the time, these are younger guys. Commonly, they had the cat flu. And there's 2 common viruses. One is the feline herpes virus. The other one is the Salivation virus that can cause the cat flu. So often these guys also are stuffy. They may be sneezing. They might have runny eyes. But this Salivation virus can also cause oral ulceration. So ulcerations on the tongue. And when that happens, one, it's painful. Secondly, it causes all this excess salivation. And that would explain the cause of the excess salivation. So you've had a younger cat who's salivating excessively. There's a number of different things I've discussed, and I do have a cat flu video. But one thing in particular that would be especially helpful for the mouth, so if they've got some type of tongue ulceration, would be this. And you could just look at doing something simple like honey. You could just mix a teaspoon of honey within a half a cup of water, and give your cat 2 or 3 tablespoons of that throughout the day. Be nice and soothing. That honey's going to coat that ulcerated area and will provide some symptomatic pain relief. and will probably speed up healing of that ulcer. Dental disease is another possibility to cause this excessive salivation, this ptyalism or this drooling. And as I was saying earlier, in our cats in particular, they can get these conditions called a forl, F-O-R-L. And if you look up here, I'm going to have a picture in the video that shows you an example of what the tooth will look like at the gum line. And so this requires you having a good examination of your cat's mouth or bring him into the veterinarian. Many of the times, the only real answer to that can be actually removing that tooth. It's really difficult once there's erosion in through the enamel. There's a topical herb called propolis, P-R-O-P-O-L-I-S. I'll just put a link to this under the video. That may provide some symptomatic help, some symptomatic relief. But once again, we know with that erosion that alone can be quite painful, being the source of causing the excessive salivation. So in many cases, often the only real answer is having that tooth removed. One of the things I often found, especially the younger cats, is they like to chew on things. It could be a plant that could be quite irritating to the surface of their mouth. It could be, it could be an electrical cord, and they could have an electrical shock and an electrical burn. Either way, in many of the cases, what it's doing is via a shock, via something like that plant, what it's doing is actually causing that mouth inflammation. You'll often see some type of ulcers. You may see the lips might be sort of red, and they might actually look slightly eroded. You might see something similar on their tongue as well. So with these electrical burns, you might actually see sort of this type of erosion on the lips. You might see something similar on the tongue as well. Regardless, that acute inflammation is then leading to that excessive salivation and that drooling. So first of all, if you do see that, I'd encourage you to get a veterinary exam. Secondly, looking at some of the symptomatic reliefs for that. Once again, something simple like the honey would be something I'd have you consider, have you think about. It's a really easy thing to use as far as treating wise. And then secondly, to something that's going to provide some additional pain relief. So you could think of something else. Your veterinarian may prescribe something like meloxicam, some short-term anti-inflammatory. Naturally, you could think of something like this theracumin or this 95% curcuminoids. What is your cat eating? One of the other big reasons in veterinary practice that I would see cats would come in drooling this excessive salivation is they're feeling nauseous or sick. So here we've got Rockstar here behind me, who's chewing on some cat food. So it would be not uncommon they've consumed something they shouldn't have. For instance, maybe you've left some human food out that doesn't agree with your cat. Maybe they've had a food reaction, say from milk, for instance, a dairy product. Maybe they've eaten some type of toxic plant, such as a lily. Regardless, causing this excessive salivation because they're feeling nauseous, they're sick. So this, first of all, I first encourage a veterinary exam. Secondly, if you're looking at something symptomatic to give at home and you suspect it's because your cat is nauseous, because they've eaten something they shouldn't have, maybe you let them try a little piece of fat or something, then you're like, oh, that probably wasn't a good idea. You wanted to symptomatically treat them. First of all, you could consider something simple, just make up some chamomile or peppermint tea. Give your cat 1 or 2 tablespoons 3 to 4 times a day. That's a fine, safe thing to do. And the other thing, there's an over-the-counter remedy called famotidine. So this is famotidine or Pepcid here. It comes as standard, so vitamin C, and they're pretty small little tablets. You can see them there. And that's a 10 milligram tablet. So a standard cat dose is about 2.5 milligrams, 2 to 3 times a day. Symptomatically, that would be something that would be okay to give, prior to seeing your veterinarian, or if you're choosing not to get a veterinary exam. The last thing I want to discuss, which sort of relates to feeling nauseous and sick and vomiting, would be organ dysfunction. So in particular, would be these older cats that have kidney disease. So most of the time, you're going to know your cat has kidney failure. They've been drinking more, urinating more often, probably losing weight. And if that's the case, first of all, I'd encourage you to get a veterinary exam, get the appropriate blood and urine test to determine if your cat has kidney disease. But as kidney failure advances, it can get to the point where your cat loses the ability to adequately filter urea creatinine. These are the two waste products from protein breakdown. And they feel sick and they feel nauseous. So one of the real other, simple home remedies that I've discussed in the past is once again using that famotidine. And it's one, it's over the counter. The brand usually is called Pepcid, but there's, many, it's now no longer trademarked, so you can just get it as famotidine for many of the drugstore generic versions. Pretty inexpensive, and that Pepcid dose, once again, is a quarter of a tablet, 2.5 milligrams, 2 to 3 times a day. So thanks you guys for watching this edition of Veterinary Secret. Thank you Rockstar for at least being in my video, kitty cat. Yes, as you can see, he's not super fond of being on video, but at least he's like tolerating as I talking to you guys. There you go, Rockstar. So a couple things. If you've got a cat that is excessively salivating, first I encourage you to get a veterinary exam. If it seems to be pretty obvious what's happened, just fed your cat something, he starts to drool, or your cat has been seizing and there may be some eye discharge, you open his mouth, you see a small ulcer on his tongue, likely your cat has calicivirus, then by all means consider some of those home remedies that I just discussed.